What if you could sit down once a week with a colleague who's a flat-out warrior? This colleague wasn't a stud in dental school. He struggled. He returned to practice in his hometown, an area once labeled by USA Today as the second worst place to live economically in the United States. And this very same colleague went on to establish an historically successful general practice known worldwide. What if you knew someone that wanted to take you by the hand and show you everything you need to know, from treatment planning to leadership, to maximizing your journey in dentistry, or just life? You ready to be inspired? Welcome to the Lionhearted.
Hi everyone, Dr. Steve Rasner back here on the Lionhearted Dental Podcast. Welcome back. This is going to be our second interview with my very long time new patient coordinator, financial coordinator, put the fires out coordinator, Michele Bondi.
Hi guys.
Perfect. Listen, last week when Michele was on, we started talking about concepts that if your office manager is watching this series of the Lionhearted, might be a little intimidated by, or you might be intimidated by. And, I expect after tonight's podcast, where we talk about the importance of getting paid up front, that may be something I'm afraid you would never approach, just like coming out of an insurance-driven practice and becoming fee-for-service practice. Mm-hmm. That's scary. We know that. And I want to read something to you, and I want you to listen carefully about everything I say. And it goes like this. Remembering that, now somebody wrote this, so just bear with me. Remembering that I'll be dead soon is the most important tool I've ever encountered to help me make big choices in life. Almost everything, all external expectations, all pride, fear of embarrassment, fear of failure, fear of rejection, all these things just fall away in the face of death, leaving only what's truly important. Remembering that one day you are, in fact, going to leave this planet is the best way I know how to tell you to avoid the trap of thinking that you have something to lose, because you're already vulnerable. You're already somewhat naked, if you will. There's no reason for you not to follow your heart. And the person that wrote that was Steve Jobs.
Okay. Wow.
And I've heard it in different forms. And basically what it's saying is that the things, I once had a podcast with you where I talked about the biggest enemy you have in terms of your ability to reach the top is the person you look at in the mirror, by the stories you tell yourself, why you can't do it, why it's not the right time, why this, why that. And if you think of it in terms, and I know it's melodramatic, knowing they're going to die, but what he's really saying is he did know, because he had terminal cancer and he wasn't going to go through traditional treatment. And when he had to contemplate for the months and months that he did, he realized that all the things he never did don't mean anything because he's on his way out. And we're all one day going to be on your way out. And maybe there's a better way of looking at it, but the point I'm trying to make is, what do you have to lose by implementing? We take very seriously the advice we give you on these podcasts. I have no agenda other than to save you time, which I know many of you know. I've gotten to meet many of you, including last weekend at a Bill Strupp philosophy course. And some of you just blow me away, just how advanced you are at such an early age. But in your way of thinking. And lots of you email me. And by the way, I invite you to email me and now Michele. My email is my name. And it's laughable because it's it's Dr. Rasner, Rasner at AOL.com. I don't know why I don't know even know why I don't even change it. I don't know why.
Too much of a following with that email.
Yeah. And yours is
Michele, Michele, at Pearl, Pearl, Smiles, Smiles.com. Michele at pearlsmiles.com, 1L.
so listen, I encouraged you last week, I'm gonna encourage you this week. And you may have more reason this week because the concepts get a little heavier. So let me start off, and I don't know how long we're going to do this because right now Michele and I are in our office, and it's, what is it, 6:15. We got to wrap up paperwork and stay here because she's nice enough for that, because I asked her. And, neither one of us really want to be here, but we are dedicated to you two.
That's right.
So it's interesting. Tonight's concept is going to be centered around getting paid up front. But before I do that, and you know me, I go off on tangents, but I think they're worthy tangents. This morning was interesting. I came in here. It's a Monday morning. I've been off for about a week plus. And, we're getting the day started. And I said to Michele, can I see you for a second before I started my day? And she goes, just a second. I gotta do a save. like that's her lingo. I gotta do a save. And I know exactly what it was. But I want you to tell our audience, what's a save? And then I'll ask you more.
Okay, a save is when you have, for example, in this case, it was Dr. Rasner's lead patient for tomorrow. 2-hour appointment. Called and said that he didn't realize that he had another doctor's appointment tomorrow and he needed to change it. So you have to find a way to convince that patient politely and professionally why they can't cancel that appointment, why it's critical.
And back in the day, it was Michele and I. And then it was Michele and I and one hygienist. And of course it grew to 2 or 3 or whatever it was. But, Michele would save a 2-hour scaling a root planing appointment. Mm-hmm. Or even a start of the day hygiene opening that was trying to cancel. And so I never really asked you, it's like sending out a mafia hatchet man to go do a job and he comes back like this. How'd you do it? How do you do it?
Obviously, if someone has a serious issue or COVID or something that is really excusable, you have to let them know.
Right.
But if it's something like that, I just suggested, I said, listen, Mr. Johnson, your appointment is 2 hours tomorrow. Dr. Rasner is super booked. I probably won't be able to get you back in here until April. So if you can arrange that appointment for tomorrow to be a little bit later or a little bit earlier, actually in his case it was later because he's your lead appointment, then we can accomplish the visit still and you can still have your other visit. And he said to me today, I didn't realize how important it was and I didn't realize how long my visit was and I didn't realize I'd be put out that far. So he said, I'll be there.
So while I'm on that subject, and I didn't intend to get on that subject, but over the years, you would save, as I just said, confirmations. Like, let me just give you an example, and this is a true story.
What's not a confirmation?
Yeah. I want Michele to tell you what is not a confirmation.
Okay, it's pretty easy. A confirmation is not calling the house and leaving a message on their voicemail without saying that I need you to call me back to confirm it, leaving your number. It's not speaking to another family member and saying, would you please remind so-and-so that they have an appointment tomorrow. It's not speaking to one of their children, for sure. A confirmation is when we have a system in our office where they confirm their own office appointments automatically. And we consider that a pretty hard confirmation because they went in there and confirmed that themselves. But if you have someone that's lingering out there, I like to get a few days ahead with confirmation. So if you have somebody that's lingering that didn't respond to the confirmation, you call them. You call them and you make sure you reach them. saying, listen, I'm not trying to drive you crazy. Dr. Rasner just needs to know that you'll be here tomorrow, or the hygienist, whatever. But that's a hard confirmation.
And no, and over the years, you guys got to hear, I'm telling you something. I don't know if this is coming across. I know she knows, because let me tell you something. I think it's hard, and I'm very lucky to have, and I'm not just saying it because she's 2 feet away, to have somebody on my team as committed to excellence as Michele is. I think it's also easy to make excuses as a business owner, or to say, oh, that's okay. That's okay. Everything. No, it's not okay. Because my thought process, right or wrong, and it was right, for many, many, many of my years, if not, maybe I let my foot off the pedal, as I've said to you, in the last 12 months. And you know what? I'm paying the price for it too. I am. I don't like when we're not at maximum operative levels. But think about it. Like when we would hire somebody, and I remember it vividly, as we grew, to take the job of what you did, to confirm hygiene appointments. And all of a sudden, I'd start having breaks that I just never had before. I mean, it really takes, and Doc, you got to care about everything. I used to have a slide that said, everything counts. Well, I meant everything. Like, who's doing the confirming? Because listen, you may think it's obsessive. We'll use that one. And the truth is a lot of people don't take, for example, hygiene appointments seriously.
The truth is also that the hygienists are depending on those schedules staying full too. I mean, they're here to work. They're not here to sit around.
Sure.
If they get 2 broken appointments, they're not happy just doing nothing.
And we can have a whole nother conversation, remind me if you can, of what is the role of a lion-hearted hygienist. I can tell you back in the day, I'll tell you what's not the role, what doesn't fulfill the role of a lion-hearted dental hygienist, being on your phone because you have a break. That wouldn't do it. And I've seen it. I've seen it with this team, and I've seen it in the past. I've also seen hygienists who always make themselves productive. I mean, let's be honest. I mean, I remember hygienists that would come to me and say, do you need help with anything? I have an opening. I'm sure some of you have somebody like that in your organization. This isn't an assassination on a hygienist. It could be of your associate's dental assistant. I could be talking about her. I mean, I've had situations for sure where my associate had a break and downtime and her assistant goes into the lunchroom with her. Are you kidding me?
Well, also, the hygienist that you're talking about, the lion-hearted hygienist, looks to the doctor's schedule at the beginning of her day and says, hey, is anyone here due for hygiene that might fall into a spot if I have an opening? You know, they really look at those schedules to make sure that everybody that needs hygiene has an appointment.
I mean, we're not selling real estate. We're solely selling our time. You have 8 hours, 10 hours a day to do whatever it is you do. And if you spend an hour a day of unproductive time because you don't have a locked-in protocol for what you do when you get a broken appointment, our team is trained that the first place you look is in the office to fill a spot, because very often, certainly when you have multiple chairs, there's somebody that may be due that slipped through the cracks, or maybe they're in the middle of treatment and they could get their prophy following scaling root planing appointment today. I mean, anything's better than an empty chair. If you're here working, you may also work, right?
That's right. That's what we're here for.
So anyway, I just wanted to bring up the save, and I do encourage the managers listening. Michele loves to teach as well, and maybe you need exact language. Maybe you need exact language from last week when Michele was talking about bringing the spouse. I mean, that's huge, to the initial new patient appointment. Really huge. Or doing the screen that she did. Because I got to be honest, she would come to me, and I know you would, if something I tried to institute to make us maximally operative wasn't working.
Yeah.
If you would come back to me and say, look, we got to change the screen. It's not working. I'm getting a lot of opposition. We got to find a way not to ask the significant. No, we've been doing this for 35 years of the 42. Because we didn't have every system in place, obviously, and when we opened up.
And that bringing a significant other is such a game changer. It really is. If they don't have someone with them and they're married or have a significant other, they're in the room together, they're sitting there together, they're listening, they hear everything at the same time, and one doesn't have to go home and tell the other, oh, let me try to explain why I just spent $20,000. It's huge.
Yeah. Yeah. We had 2 new patients today, and we've had a dearth, by the way. I don't mind. I always share with you the truth, and we've had more new patients than we have in the past, and we've had in the first 6 weeks of 2022, 23, I mean. And we had 2 today. Got them both. Not huge treatment plans. Just sometimes I like to tell them, and you actually, what I'm thinking. So, because I think it helps you. But I think it helps you when you feel these stories. So imagine a patient coming in, about 58 years old, I'm not sure how old she was, with her husband. Both of them had spouses and significant others with them. And she's difficult. She comes in, and her chief complaint was a lower right broken tooth. Okay? So I want you to hear my operative. I keep saying operative. My thinking. Hadn't been to a dentist in a long time. Her major driving force behind that was fear.
Fear.
So, she already knew that. She had it in her when she coached me. I don't know if I made it clear, but Michele re-screens them in the office. Brings them in, spends 5 minutes with them. By the way, what do you say?
Well, if there's significant others together, I say, Mrs. Jones, I'm going to take your husband back, and we'll bring you back as soon as we finish his x-rays. So I take him back, and I say, hi, I'm Michele. I'm the one that made your appointment for you. Nice to meet you. Get a little cordial. And then I open the chart that they've already filled out, and I review their dental history with them. And I ask them more questions about things that they wrote down.
They know you ask some of these questions over the phone. Is that ever awkward?
Never,
No?
because you're being very casual with them. I know you told me about this, but you told me that your gums do bleed.
So why would you do that? Why would we possibly re-ask them?
Number one, I'm reaffirming that I got the information correctly. That's for me. It's before I talk to you. And number two, it's kind of stirring things up with the patient to remind them they have other needs.
So see what Michele just said? And I know I haven't gotten to about getting paid up front yet. But there's a lot that goes in to getting yes. And if you don't get to yes, you're not getting paid anything. Right?
Right.
And by the way, I'm skipping ahead for 1 second. I know you'll test. For any of my patients that are watching this, we don't get paid up front because we're greedy. We get paid up front because it ensures a commitment to you finishing your treatment.
The last thing it's about is getting into their pocketbook. That's the last thing. We want a commitment so that when we make that 2 or 3 hour appointment, we know the patient's going to come and they've made a commitment. However, if something comes up in their lives and they call me and say, hey, I really can't do that, they're immediately refunded for anything they haven't had done. So it's nothing like getting into their pocketbooks. You're just making a solid
I want to make sure they understood
schedule.
what you just said. In other words, sometimes a patient, after they commit, pay us, have
it's
life-changing thing. Or
Yeah, I was going to say, it's usually not second thoughts because they've really bonded with you by the time they leave. They bonded with me. Hey, my water heater broke and I really have to make an investment, blah, blah, blah. And they really just can't proceed. I believe them and I have to document everything and we refund them. So it's...
And let me tell you something very candid, and listen to me. I'm going to have Michele on as many times as I can to get all the information that I think you should have. And by the way, you know we want to do a live 2023 in the fall. I hope, where you guys can meet Michele and we have workshops, and you have to get this down, right? This can't be, it only works for him. No, it doesn't only work for us. We've done it for a long time. And I really try to be as straightforward and give you all the detail as I can. And I was about to say, listen, there was a time probably when somebody would call us that committed to a big case and couldn't do that case. And we would try not
Forcefully.
No, I don't mean forcefully. I don't mean, we would often see if we can convert them to a lesser case. Okay? And it wasn't with bad intention. I think our number one goal for the last 10 years has been, and I've said this to you guys, whether they commit or not. And a lot of people in the last couple months haven't committed, to be quite frank. It'd be very hard for me to imagine, Michele, that anybody could leave with a bad taste in their mouth and think that we try to jam it down their throat
No.
or anything like that.
You spend way too much time, quality time. I tell the patients, listen, Dr. Rasner is going to be very thorough with you today. He's going to take his time, and you're going to know everything there is to know about your mouth before you leave.
And I kind of
choices
got,
are always theirs. You know, they make the final choice.
and I'm sure they'd rather know more about getting paid up front, which I'm going to tell you right now is going to spill until the next podcast, because never going to have enough. But I want to go back to where I was, and I want everybody to know my thinking, because it's not always the best ideal dentistry. This woman hadn't been to a dentist in 10 years. So what she had was, I said, what are your chief complaints? And she said, my mouth or maxillary teeth always feel so full. Well, what I found when I looked at her were two impacted premolars. You've seen this before. Sandwiched between her premolar and her cuspid. So they literally were lingualized in a maxilla. And she did. That was a good way of defining her mouth. There was too many teeth in this space. And she never had ortho. She was missing number 19. The only significant caries she had was 30. Okay? And she definitely needed scaling root planing. Remember what I tell you. There is no room in a Lionhearted practice for tissue inflammation before you start treatment, because you can't compromise on that.
And that brings me
Good.
to a point. I'd like to go back to when you say I screen them in the office. It's always in the operatory, and many times they'll actually show me things. Like that woman today bent over and showed me the
Did she?
tartar that was behind,
Right.
on the lingual of her lower anterior. And she showed me the missing tooth, and it's a lot different to have them show you than just talk on the phone. So it's a different perspective.
Yeah, and I'm going back and forth, but I don't want to forget something that just came up. I asked you why we re-screen them in the room, and why do we bring the spouse? And one of the answers is, I used to say it like this in my live lectures, is people lie to you over the telephone. And I think I really do. I think they do it as a denial mechanism. Like, if they tell you that all that's wrong is a broken right molar and everything else is good, we won't catch it. Because we won't, really? And so, as Michele says, going through and asking them provocative questions, important questions, makes a patient realize, wait a minute, maybe there is more going on. And we're so far above, as I hope all of you are, and I believe you are, creating things that aren't there. I'm not even going to recommend changing old amalgam restorations that I can't find anything wrong with unless the patient wants me to. So I think you should always err, and this is a very, very important concept. If you think long term, and my practice has been busy from the beginning. I mean, with the exception of a slump, as I told you about in 2008 and part of 2009, we've always been busy. And if you think long term, you really want to err on the side of being conservative in general. Now, sometimes you can't be conservative. you have a patient with posterior bite collapse or wore down or vertical dimension of occlusion, you can't treat half the right side of their mouth. So you should keep that in the back of your mind.
Not responsibly.
Yeah, you just can't. I mean, there have been cases where I crowned 2 through 11, and 4 more crowns would have been significant money to this patient. So I had to hold vertical with composite restorations. It's because composite is as much as a crown. So yeah, there's some ways you can figure it out, but often you have to use interdisciplinary. They need ortho, they need whatever they need, and you just can't segment things very, very well. So,
well, we were talking about interviewing them in the office.
Yeah. The end take on interviewing them in the office and bringing their spouse is very, number one end take is it's worth it. It's worth you having somebody take 5 or 10 extra minutes. Just maybe the patient feels more comfortable in person.
Let me tell you what's really frustrating. When the spouse comes in and they say, I make all my own decisions, and then Dr. Rasner goes through this lengthy consultation explaining everything, showing each periapical x-ray and going over perio, the whole thing, and then he leaves the room and I go in and present the cost. And what do you think they say? I have to go home and talk it over with my wife or my husband or my spouse, whatever. It's just frustrating because they can't explain it to them. They
Sure.
can't explain it as effectively as by any stretch as if they were sitting there listening to you.
Yeah.
It's just monumental. It's huge.
Yeah, it is a really big deal to have the spouse there, and you're not going to get them 100% of the time. And they're going to say to you what Michele just said. Sometimes they're going to say, I make all the decisions.
And I don't need them there.
Yeah, so think about it. I mean, we talked about this briefly last week. I mean, what's the magic number for any of you? What financial commitment, whether it's an appliance in a store or yourself, how far are you willing to go without discussing it with your spouse? And we live in a day and age in dentistry. And if you don't have an insurance, 1-tooth pract, 2-tooth a year practice, it can be very significant. It can be obviously highly north of even $10,000. So it's such a fundamental thing to me,
It really is important, yeah.
I know I'm jumping all over the place and we're already...
I will say that
Please.
If a patient calls and says, hi, I just moved to the area, and they sound squeaky clean.
Yep.
I go every 6 months.
I get it.
I have no missing teeth. My gums don't bleed. They don't have to bring their stuff.
Yeah, I mean, I think I've implied that to you guys before. And we don't do it on 100% of the patients, but certainly we take a crack at every other one. And when they get here, a lot of things change. I mean, you've told me stories that, oh my God, you won't believe what just happened. And they broke down and they started crying. I made a joke out of it before, but the denial thing is real. I mean, I really do think that patients minimize in their mind what's wrong.
Right.
And look, we're not looking to pad their bill or make them do anything they don't want to do. We are looking to make them as healthy as we can possibly make them. And so let me finish the story on it. We're going to have to do the getting paid up front thing next week. I'm sorry. But I want you to know how we think. And so what happened is she was missing number 19. So what did I say to that? Okay. So I said to her, let me explain something to you. And I went in, I started, just like I do on my podcast, with my philosophy of care. Where are you sitting today? Because you could have been in 20 other dental offices within 30 minutes of this office. And we all think differently. So this is where I come from. And I've gone into this with you guys before. And I've talked about, if you're passionate and really, really into what we chose to do, like so many people that I met this weekend at Strupp, then I think you should share that. Because it boisters a voice of confidence that you like what you do. I know that sounds silly, but it's not. And when we got to talking about what she needed, I said, listen, if you went to a university or even another doctor and somebody said you have to have ortho or you need ortho, they wouldn't be wrong. I said they would not be wrong. My approach to you, because of your fear, because of you, this is your treatment plan, Christy. I did. I said, and her husband's right there. And this was a nice looking couple, but they didn't look like they stepped out of GQ magazine or Cosmo, like most people. Well, neither do I look that way. So I said, this is what I would do. I absolutely, you have to scale and root plane. There's always the have tos, and I would like to. I said, obviously we're going to treat the chief tooth you told me about on number 30. By the way, if it's borderline, it's a crown with me. It doesn't have to be down or an onlay, or it could be an onlay, it could be an inlay. It's going to be a laboratory made restoration whenever I can. Why? Because they work better and they last longer. And the only person stopping that from happening is you. That's the truth. But why didn't I deal with number 19? Because I could have. I really believe you know what I said to her? I said, look, I could easily recommend you replacing the one tooth you haven't, that you lost a while back. Why don't you go through this and get to know me? See if I literally said, see if we are who we say we are, or am I a fraud? That's what I said. You know, because you remember, one of her chief things was fear. And ironically, the second new patient today
Both of them. Never
never had anything but IV sedation. So I take that very seriously. So I'm just telling you, I could have talked about all kinds of other treatment on her, not the least of which would have been ortho, and I didn't go there today. And she's going to leave phase 1 of treatment with a clean mouth, no caries, good perio.
Minus the 2 teeth.
Yeah, I'm going to remove the 2 impacted premolars. And that'll be done here under sedation. You know, it wasn't a giant treatment plan. Do you mind if I ask you what it was? You could say it.
Well, she had really good insurance, so I think it was around $3,000.
Okay. So keep that in mind. We're an out-of-network provider, but we'll take what their insurance gives them.
They have to have out-of-network benefits.
Yeah. So don't think that that going out of network means you never ever were able to get insurance from a patient, because it is absolutely true for some insurance companies. And a lot of insurance companies are pushing that if they're out of network, you can't go to an out of network dentist. But they've been threatening that for the last 7-8 years that I know about. Look, I know I promised you that we would talk about getting paid up front. I hope.
I think we need a whole 30 minutes for that.
Yeah, we know. Yeah, we need 30 minutes to talk about exactly what you say when you walk in the room. The truth. I want them to, what's the worst thing that can happen? Tell them right now, what's the worst thing that can
Probably
happen?
what I said. Let me go home and talk to my spouse. I hate that.
Right. Yeah. So, look, this is a road less traveled by us, by Lionhearted Dentist. I never said it would be easy, but I talked to a colleague of mine today that is expanding his office and taking insurance. And boy, you know, when you're taking a loan for $500,000 to expand your office, are they only charging you for $400,000 of it? No, they're charging you $500,000 of it. But when you get paid $100 on your services because you haven't taken the leap for a fee, you're not getting $100. You're getting 60, maybe 70 at the most. I'm talking about insurance.
Right. Oh, yeah. I remember those days.
It is really, really hard to break free from that. And we're not trying to get you to do it in 2 weeks.
It took us quite a while to come out of one of them. Yeah.
I think it's a year process.
But when you look at the size of the write-offs that you're taking, it's just terrible. We don't raise our fees. You know, it's just
Yeah, I
a
mean,
big chunk.
being fee for service, being comprehensive. I have a toothache. It's all you treat is a tooth and hope they come back. That is not a long-term recipe for success. You agree?
I totally agree. And I have to say that even when they leave and say, I have to talk to my spouse, they never leave angry. You know, they're never upset.
Yeah.
They might be a little bit sticker shocked sometimes, but they're not angry with us.
Well, it's easy to be sticker shocked when you leave an insurance-driven practice that's going to let insurance companies treatment plan the patient, as opposed to letting health enter in. Like, what do they need to be healthy to be the deciding factor on what you'll recommend?
And it allows you to really take care of your patients. You don't rush them in and out. And if we have somebody leave because they said, oh, I'm going to go where they take my insurance, I can't tell you the number of times they come back because of the care.
Yeah, I heard somebody, I'll leave it at this tonight, guys. I heard somebody say this weekend that he thinks it's the easiest time ever to go and be a Lionhearted practice. And I'm not sure, to be honest with you, and I always try to keep it straight, that that's true. But one of the reasons it could be true is because it is so much easier to palpate the difference between a Lionhearted practice and a practice that takes insurance and sees. I mean, there's somebody online that recently posted they saw 108 patients in this size office. We have 7 operatories in one day.
In a day?
In a day.
That's ridiculous.
Right? I mean, even if you, I mean, I don't know what I saw today, but.
That's a revolving door practice.
Yeah. I mean, at the end of the day, I hope you understand that we're trying to gear you towards better health for your patients and better health for you and long-term success. I thank you, Michele, for joining us once again.
Honored to be here. Thank you.
And remember, send your questions in if there's something you wanted to talk about besides the obvious that we're leading up to, and that's getting paid up front. Thank you again.
Thank you, Doctor.
See you next week on The Lionhearted.